Let's now talk about the specific drugs or the specific local anesthetics. So the first is cocaine. So it's historically significant because it's the first local anesthetic. So the clinically desired actions of cocaine are the blockade of nerve impulses as a consequence of its local anesthetic properties and local vasoconstriction. However, its use is limited because it has a potential for abuse. It has a potential for abuse because it has euphoric properties, and the euphoric properties are due primarily to inhibition of catecholamine uptake, particularly dopamine in the CNS. So it is currently used primarily for topical anesthesia of the upper respiratory tract, where it is its combination of both vasoconstrictor and local anesthetic properties provide anesthesia and shrinking of the mucosa. The most common is lidocaine. So it produces faster, more intense, longer lasting, and more extensive anesthesia than an equal concentration of procaine. So procaine is the first local anesthesia developed after discovery of cocaine. So lidocaine is available as a transdermal patch, as a occlusive dressing, or even as peels. So when you say peels, they're just like transdermal patches that are placed on the skin, and then they are removed, and then so these are usually for dermatologic procedures. So lidocaine is absorbed rapidly after parenteral administration and from GI and respiratory tracts. So it has significant systemic effects. Side effects of lidocaine seen with increasing dose include drowsiness, tinnitus, dysgeusia, dizziness, and twitching. Dysgeusia refers to a change in taste or a change in the sensation of taste. So as the dose increases, seizures, coma, and respiratory depression and arrest can occur. If you remember, lidocaine is also used as an antiarrhythmic agent, and it affects the myocardium. So bupivacaine is another local anesthetic whose structure is similar to that of lidocaine, except that the amine-containing group is a butylpiperidine. So it is a potent agent capable of producing prolonged anesthesia. It's actually known for its long duration of action. So its long duration of action plus its tendency to provide more sensory than motor block has made it a popular drug for providing prolonged analgesia during labor or the post-operative period. However, it is cardiotoxic. This is manifested by severe ventricular arrhythmias and myocardial depression after intravascular administration. So that's why this is something to look out for when using bupivacaine. Other local anesthetic for injection include articaine, which is an amide local anesthetic used for dental and periodontal procedures. It is used for its rapid onset and duration of action. You also have chloroprocaine, a chlorinated derivative of procaine, which also has a rapid onset and a short duration of action. You also have mepivacaine, an intermediate-acting aminoamide with pharmacological properties resembling those of lidocaine. Mepivacaine is more toxic to the neonate, so that's why it is not used in obstetrical anesthesia. It is also not effective as a topical anesthetic. Prilocaine, it is another intermediate-acting aminoamide with pharmacological profile similar to that of lidocaine. The primary differences are that it causes little vasodilation, and thus it can be used without a vasoconstrictor such as epinephrine. So its increased volume of distribution reduces its CNS toxicity, so that's why it can be used for intravenous regional blocks. However, its use is limited to dentistry only because it can cause methemoglobinemia. Another is ropivacaine. So it is suitable for both epidural and regional anesthesia with a duration of action similar to that of bupivacaine. But remember, bupivacaine causes cardiotoxicity, so ropivacaine is a good alternative to bupivacaine. It was actually developed because of the cardiotoxicity of bupivacaine. So procaine replaced cocaine because cocaine became abused for its euphoric properties. But procaine had severe allergic reactions, So it was replaced by lidocaine. So anan alang gyud ta. Replaced na lang gyud ko na ibag-o nga mas maayo. The last is tetracaine. It is a long-acting amino ester, significantly more potent and has a longer duration of action than procaine. However, it may exhibit increased systemic toxicity because it is more slowly metabolized than the other commonly used ester local anesthetics. It is widely used in spinal anesthesia when a drug of long duration is needed. And we also have the EMLA or the EMLA, which actually stands for eutectic mixtures of local anesthetics. So this is made up of lidocaine and prilocaine for brand name EMLA, and lidocaine and tetracaine, brand name Pliagis. So this bridge the gap between topical and infiltration anesthesia. So the efficacy of each of these combinations lies in the fact that the mixture has a melting point less than that of either compound alone. So these exist at room temperature as an oil that can penetrate intact skin. These are marketed as creams that are applied topically. So they actually are able to produce anesthesia to a maximum depth of 5 millimeters. So it is applied on the intact skin under an occlusive dressing in advance of any procedure. So that's around 30 minutes to 1 hour before a procedure. That involves a depth of only 5 millimeters. So it's also effective for procedures involving skin and superficial subcutaneous structures, like for example, IV insertion or skin graft harvesting. But it's also important to take note that the component local anesthetics will be absorbed into the systemic circulation. So it can still actually potentially produce toxic effects if you're not careful. So lastly, here are just two tables I will show you about agents used in epidural and spinal anesthesia. So you have chloroprocaine. It has a short duration, but epinephrine prolongs the action. Lidocaine is has an intermediate duration. Bupivacaine and ropivacaine have a long duration of action. For spinal anesthesia, for short procedures that are 60 to 90 minutes, you can use lidocaine. For long surgeries or for long procedures that take up to 3.5 to 4 hours, tetracaine and bupivacaine are used.